I invite two chairpersons, Dr. Narendra Pal sir, physician from Noble Hospital, Delhi, who has immense experience in alprazolam-based injections for treatment of Doppler and the erectile dysfunction. And I invite my good friend and my senior person here in Trichy, interventional radiologist Dr. Gajanan sir, managing director of Magnum Scans. And we believe he is one of the best persons in Trichy who's doing a wonderful job with clinical Doppler assessment. Because whenever we send the test, if he does, so we believe that is why I want to give a claim. And I personally tell the patient that go and inquire. I won't refer to Magnum Scans, I refer to Gajanan sir. Go and inquire if Dr. Gajanan is there, you do, or get his appointment and do. So, and I welcome my good friend Dr. Gajanan sir. And I want to add a few important accolades for him. As told before only, sir. He doesn't put his name as urologist. He's a urologist with a consultant in sexual medicine because he had done his postgraduate diploma in sexual medicine and in Netherlands. He has gained accolades and he's got multiple awards from ISM, from Dr. Kerman also. And for this talk, he's going to talk about a certificate because he has given multiple certificates, whether the marriage is void or null. Thank you, sir. Thanks for coming all the way from Chelsea. Thank you.
May I take 1 minute?
Please, sir.
Make an announcement. As highlighted by you in the morning message, I request the speakers to stick to the time allocated and respect the buzzer because it tells you 2 minutes is left, so that we have a little time for question and answer and make the lecture and the conference more interesting.
Thank you so much. Thank you.
Very good morning, ladies and gentlemen. I agree with the moderator. Time is important. And yesterday, Dr. Ravi, he spoke at length about restorative therapy and regenerative therapies. I was just telling him in the morning that as per his presentation, other than time, everything and else can be regenerated. So, unfortunate that we keep on going beyond time and time prevents us more. So, without wasting much time, I should move on. Myself, my very good friend Dr. Nitesh has given an introduction. And let me tell you, this giving potency certificate and talking about potency certificate raises a lot of controversies. Because potency certificate is more of a legal domain than a medical domain. Right? Do you remember this person? Yes. And I was a MCH urology postgraduate when we gave the potency certificate to this man. And I was a PG with my professor Dr. Keshavamurthy. So I think I'm more entitled to talk on a potency certificate than anybody else. So moving on to disclosures. As you can see here, nothing, it means no disclosures. Now, Webster's dictionary definition of potency: the quality or state of being potent, physical or moral power, inherent strength, energy, ability to effect a purpose, capability, efficacy, and influence. There is nothing sexual about it, as far as Webster's dictionary is concerned. But unfortunately, the law, there is many things legal about it, and which matters most with respect to issuing a potency certificate. It's more important because of this particular section of IPC, section 375, deals with rape, and recent amendments have come following the horrendous incident at Delhi, following which there is no need of penetration. There is no need of penetration of the genitalia of a woman to declare it as a rape. So, need not be, penis need not be hard enough. You can use any part of the body, even simple touching also amounts to rape. So, potency certificate doesn't hold that value with respect to that particular capacity in law with respect to rape. And that clause is being changed to section 63 of PNS Bharatiya Nyaya Samhita. This that is being put, it has come in Parliament recently. It is section 63 of the BNS. Now, the other important thing is nullity of marriage. So, potency certificate is more important in this nowadays because of all these acts. Whether it's Hindu, Muslim, Divorce Act, Parsi Marriage Act or Special Marriage Act, all of them require potency certificate. Right? So, when it is sought, criminal cases, rape, adultery, unnatural sexual offences as prescribed by law. See, I tell you, I should be very clear here because International Society Sexual Medicine doesn't say anything is unnatural. Right? But as prescribed law, the law still feels that there are certain sexual offences which are unnatural. So, as a scientist, as a doctor, as a sexual medicine practitioner, I may not feel that it is unnatural, but as a legally binding physician or a medical practitioner, you are supposed to opine with respect to that particular aspect of law. One should remember. Number 2, civil cases like nullity of marriage, disputed paternity, claims and damages arising from injuries resulting in impotence. Right? In these cases, potency certificate is sought. So, examination is to be undertaken only after written request by competent authority. This is very important, and unfortunately, we as practitioners always are ready to declare a person potent or impotent only on the basis of certain, there is a community, we should not name the community because it's a scientific problem, where people come and say the consummation has occurred or not. They want a certificate. Can we issue a certificate? No, it's not possible. Legally, it is impossible. Right? But unless IO, investigating officer, gives a request, I don't know how many of you have done a postmortem, because I keep on doing postmortem nowadays, even now, because despite doing urology, I am a government doctor. In Karnataka, all government doctors are supposed to do postmortem irrespective of the degree. Right? So, I am supposed to do postmortem for which I get a requisition from IO. Similar requisition is provided by IO to you, and you are supposed to follow that requisition and to take up certification. And not by somebody who comes to your OPD and says, "ये देखो sir, ये जो दामाद है ना, ये ठीक नहीं हुआ ऐसा." No, this doesn't work that way. He cannot. If the person sues you in court of law, person affected, you will be behind bars if you give a certificate like that. Right? Consent need not be taken when the person is under custody, whether judicial or police. This is section 53 of IPC. Sorry, CRPC. So, no need of consent. Detailed history is to be taken prior to examination with respect to habits, occupation, diabetic status, trauma, sexually transmitted diseases, hypertension, endocrinopathies, CNS disorders, surgery to pelvic organs. Details of which I don't go into because one is lack of time, another is all of you are learned people, how it affects potency, you know. Now, what are the things to be examined? Whether he has performed masturbation in the past or not. Number 1. Number 2, night emission, early morning, erections. These are the important things. Focus on sexual history. What are the things to be noted? Right? History of having performed penetrative sex before. Deviant sexual practices. As I said, deviant, not unnatural or perversionism. Right? Next, level of libido. Whether he has fathered any biological children. Please understand, whether he is biologically his children or not, or secondary sexual character. These are the things to be noted. Now, how to issue a potency certificate? Probably I have issued 27 years of my service as a government medical officer. Now there was a question, who has to issue a medical certificate, potency certificate? Whether it is only urologist, any registered medical practitioner can give a potency certificate, please note. You don't need to be a urologist. But if you don't want to go and stand in court of law, you can refer, saying that I am not qualified. This is the way to get out of the court. See, I'll tell you why. The biggest problem in potency certificate, right? See, you might have been a witness in a murder case. It is easier to come out. If you are an expert witness in a case like which I showed there, this slide, or where the financial compensation is claimed or divorce is sought, it is very difficult. The opposition lawyer will cross-examine you and he will pin you down. So the best way is to get out of it, for me, right? So I might have issued more than 100. There is nothing to suggest that the said person is incapable of performing sexual act is the best way to issue a certificate. There are two double negative. No way I have said the person can perform, but simple thing, cannot perform, करके भी नहीं बोला. There is nothing to suggest that he cannot perform. Right? This is the best sentence, but I tell you, there is a but there. The negative certificate is the said person is incapable of performing the sexual act due to the below mentioned reasons. You have to give reasons. These reasons are under judicial scrutiny. And are there any lawyers here? No. Law is an ass. So, should know how to write it. Otherwise, what happens is it will kick you. So, the reasons are under judicial scrutiny, and unfortunately, the person who is standing before you in a court of law is not a medical practitioner, who is not your friend. That's the biggest problem, right? So the reasons can be questioned based on his limited knowledge of forensic medicine book. It's only book, forensic medicine book, and nobody bothers what he said, right, wrong, whatever is the case, and the judge will take it verbatim. It is written down. Have you gone to court of law? They write it down. The so and so person has said like this. In Kannada we say, they write it. That is unfortunate. So you cannot, if the reason is questioned, if you cannot answer, then you will have a problem. The most worrying factor when you give a double. So I was asked in the morning, then why we should do all those tests like cavernnosography, Doppler. The previous speaker also mentioned Doppler study has to be done, right? Why all this is necessary? It is easy to give a potency certificate. Is zarurat kya hai? This state versus Jai Bhagwan Bandla case on 21st December 2014, the fast track court in Delhi has raised objections to the manner in which potency examination of an accused was conducted on above lines and double negative certificate. This happens when you get caught in cross-examination, unfortunately. Right? And the court also ordered Ministry of Health and Family Welfare, Government of India to frame the guidelines for potency test of the accused if necessary. Nothing has been formulated yet, but that is why people demand more and more evidence. We go into the web of this vicious cycle. I always tell my colleagues, whoever who are there with me, be confident in court of law and say, stick to what you have said. You also carry a book of forensic medicine, read it thoroughly and go and stand in front of the judge. Nothing will happen. You don't need all these things. Right? And these are, additional evidences. People tend to go and stand in front of the court. But, sir, I am finishing in time. This is the, pro forma. Sorry if you cannot read. This is taken from Telangana. Pro forma from Telangana it is. You are supposed to give them this pro forma. This is potency certificate. And the take-home messages are: potency certificate is a medico-legal document, needs to be issued after a thorough history and examination in a double negative manner if you want to be safe. Right? Most important requirement is the ability of the certificate and the certifier to withstand cross-examination. I know that the potency certificate has not passed the potency test here because it is not too explanatory, but unfortunately, potency cannot be established within a span of 15 minutes. Unfortunately, dear Chairman, sir, if you have questions, thank you.
Thank you, sir. That was a topic made so simple and clear-cut and very straightforward. So, if there are any questions from the floor, we will take the questions from the floor.
Sir, mic.
Having two questions.
Sir,
Audible, sir.
so what else?
One is, we talk about the unnatural offences put in the law, but we are not agreeing on unnatural offences.
Yes.
Should we expect that laws to be changed? Because this is, our stand is different, law is saying different. How can you certify?
Sir, with all due respect, sir, there are two issues. One is legal, another is scientific, right? So, in court of law, it is the legal language that matters, not the scientific language. However scientific you are,
That's what you told.
number one,
But I say, we have to insist the laws also to be recognized this is not unnatural. Then only we will stand good.
absolutely, I agree with you that all medical associations should stand together and say, tell it to the court of law. Anyway, 63 BNS is being done. Kindly
Second thing is,
yes, sir.
regarding the elicitation of past history from the patient, you ask whether you are masturbating, whether you are having nocturnal emission, whether you are having early morning erection. The patient says, when he is not having that, I am having. How can we prove?
I did not get you.
So-
When he says that,
Past history, we are going to ask,
yes, sir.
have you ever masturbated?
Yes.
Have you ever had nocturnal emission?
Yes.
Have you ever had that early morning erection? The patient says, yes, I am masturbated, but we don't have any proof.
Sir, you are an examiner, you are a special witness in the court of law, right? Whatever you write, if you withstand the cross-examination scrutiny in the court of law, it is not the patient who is saying, you are certifying him. And the patient is not asked in the court of law. You stand in the box, witness box and answer. And the cross-examiner or the public prosecutor shows you the certificate. Is the certificate, please let me complete, sir. Is the certificate issued by you? You say yes. In the certificate you mention that history of masturbation present, you stick to it. Patient need not prove it, sir.
No, need not prove it, but
Yes,
I am
sir.
giving the history, as you say,
Yes,
we
sir.
have to complete the form and I put is having masturbation.
Yes, yes,
Thing
yes.
whether I cannot prove or not. That's
You
all.
need not.
No, sir, the question is asking what if the patient lies?
Yes,
So,
Yeah.
what if the patient lies?
That
How
is-
are you
that
going to
is-
certify?
Yeah, this is actually he asked something different and this is the perfect question. Agreed. Right? Even if the patient lies, history of masturbation absent doesn't mean that he cannot perform. What we are giving, there is nothing to suggest. See, secondary sexual characteristics are there. Yes, you examine him. While examining, if the person has got normal genitals, normal sexual characteristics, you can definitely say there is nothing to suggest. There is nothing to suggest. We are not telling that the person is able to have erection. There is nothing to suggest that the person cannot have potency, that is, cannot have erection. That's all. You are not actually, saying that the person can have erection. There is nothing to suggest. So, sir,
Young urologist from the neighboring Karnataka will welcome you.
thank you, sir.
And delighted that you could have a view of our Godman. You said that as you rightly named as laws, I said good, and nobody is a lawyer here. Suppose if I'm an expert witness for the defense side like that, you said that you are a neurologist, qualified man. But if I ask you, are you registered as a sexual medicine expert, what would be your answer then?
Sir, NMC bars me from calling myself a sexual medicine practitioner. That's my answer. Sir,
So
I
that
tell
means
you.
is it valid? So yes,
Sir,
my request is that you develop this specialty as a legally accepted. That should be rather than merely conferences. You have this conference has been going on. I met Narayan decades ago. Still, it is. See, India is a Kama Sutra country. So at least you people, you are a government servant. Some institute should develop. Okay.
Absolutely, sir.
Number two, is a practical question. Again, these certificates, is it genuinely used to make sure that nobody is, genuine innocent is convicted, or this is a escape phenomena from your experience? It may be out of
Yeah. My experience, sir, I have given only genuine certificates, and how it is used is left to the investigating officer. I can't answer this question.
Dr.
Yeah.
Gajanan, excellent lecture. I think we should again stick to the time.
Absolutely, sir.
Excellent talk. Is it after Nirbhaya case in 2012 that this law was formulated in 2013, and the Asaram Babu also, as you know, and you give the other example,
That is
that 375 modification has
Yes.
come into play.
Yes, sir.
Now, what I understand, that this certificate is based on the subjective history, examination, etc. So where are the objective components, which I thought is a must in the code of law, like semen examination? I know they are irrelevant, pipe test and nocturnal tumescence, all those things. Are we supposed to do the objective test as well, documented?
No, sir. There is no need to document everything. Semen analysis doesn't come into play at all. See, because fertility and potency are two different things.
No, suppose there is a pregnancy and you have to sort of, correlate with that,
That is, sir, that's a different issue, sir. When you are doing a disputed paternity, you have to have both potency as well as fertility.
Yeah.
Right? This is not a potency alone. You don't require semen analysis. However, having objective tools is a boost to withstand cross-examination. However, if you are good enough, you can withstand with whatever subjective evidence you have. Sir, the most important thing in court of law is telling it in the most brave manner that what I said is correct. And you are, please understand, you cannot be convicted for perjury if your certificate and what you said is correct.
Sure.
Perjury is you have given a certificate and you don't stand by the certificate, then it is perjury. Perjury is telling a lie, under oath. So now, whatever knowledge, the best possible knowledge I have, this is what?
Sure.
My inference, and you will pass.
Sure. Thank you
Thank you.
very much. Excellent talk. I repeat.
Thank you.
I request the chairpersons to come and felicitate the speaker.